Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Dr. Kenneth Hamby, who recently opened the newest Novant Health Oceanside Family Medicine. We'll also speak with Christy Williamson from the Brunswick Beacon and Victoria Humphrey from Novant Health Brunswick Medical Center about the 2014 Brunswick Beacon Health Expo. Our final guest is Dr. Linda Calhoun of Cape Fear Heart Associates, who will share her expertise on women's heart health. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Dr. Kenneth Hamby of Novant Health Oceanside Family Medicine. Well, welcome to the show today, Dr. Hamby.
Thank you. I'm very glad to be here.
It's such a pleasure to have you. I'm so excited to learn all about you today. This is going to be a great interview. So I know that you just recently moved to the area. So where did you practice before you joined Novant Health?
Well, I was previously practicing in Pawnee, Oklahoma, with a IHS facility, the Pawnee Indian Health Clinic. I had an obligation there, and it was a great place to practice. I really enjoyed working with the Native Americans.
What brought you to this area? How did you find Brunswick County all the way from Oklahoma?
Well, we did a little research. We spent a year looking for our basically place we're going to retire. So this is a place that
You're too young to retire.
Oh, of course, but someday, exactly. We wanted some place where we sink down roots, and this was a destination close to the coast. I dreamed all my life about living by the ocean, and we vacationed in the Carolinas, South and North Carolina, throughout the years, and just love the people, love the spirit and the things to do. I love biking, kayaking, and fishing, and they're all available year-round, and it's a dream.
Well, let's talk a little bit about your education and your background. Now, I know you said you had an obligation to the Pawnee Indian tribe, and so is that how you went to school? And
yes, coming out of high school, I went in the U.S. Army and spent 3 years as a medic, and I really got some good training there. And then coming back, I worked with the post office, but I loved having those medical skills as an EMT, and so I joined the Air National Guard, and they offered a college tuition waiver, and I was able to go to school at night, and I got my prerequisites for medical school. And so going into medical school, I needed some help financially there, and
Sure.
And being part Cherokee, I approached the Native American population, and they were more than glad to pay for medical school if I would give them a payback obligation of year to year, and it was a great decision.
So you're in a brand new practice here in Brunswick County. So let's talk a little bit about that. It's recently opened.
That's correct. It's a brand new family medicine practice, but it is part of Novant Health Oceanside Family Medicine, and it is the Bolivia branch, and it's right across the parking lot from Novant Health Brunswick Medical Center, and great location.
Perfect location. What a great landmark. You can say, yes, I'm located just next to the hospital.
You can't beat it. I've got the best surrounding physicians to refer to, and get to go just across there and meet with the staff and the great volunteer staff they have. I just love it.
Wow, I'm sure they love you too. So the office is located in that medical office building there that's right across, and so you do have some peers right next to you. You have the surgical services, and you've got Brunswick Women's Center, and so you've got quite a few
That's correct.
practices in there.
Cardiology, urology. You know, we're trying to become very easy for the patients to find, and for referrals so they can literally walk a few 100 feet.
That's right. Now, I know that you're a doctor of osteopathy, and that might be a kind of a strange term for some of our viewers. So if you would, please, could you talk a little bit about the difference between osteopathy and...
I would love to. You know, as a medical student going into medical school, I had choices between allopathic or osteopathic. One of the advantages to being an osteopathic medical student is you learn a different base philosophy. Instead of just focusing in on a disease process, I like the idea we take on the whole person. We look at the disease as only a part of the whole. And when we're treating somebody, it's a philosophy to prevention of medicine, prevention of disease, looking at vascular, neuropathic, and lymphatic flows, and to look at proper alignment, and to look at the spine, and to be able to put your hands and diagnose and manipulate the spine, manipulate joints, so that you can do more than just, you know, giving some medications. But what I did enjoy about that is that we all train at the similar residencies.
Sure.
We take the same type of boards.
Right.
The qualifications are identical. There will be very little difference between the training, except for that, what I feel is an extra ability to do manipulation.
Yes, I like the concept of treating the whole person, because you know, we're a person first.
That's right.
Who happens to have an ailment.
And my philosophy is that it's a partnership, and the patient is there to, you know, get good health, and we're going to help them every way we can.
And so, in your practice, you're the solo practitioner currently.
That is correct. The plan is to eventually grow into a second provider, but right now I'm in a solo practice, and we are available to take new patients.
Speaking of patients, you see both adult and pediatric patients?
That is correct. We're restricting age 2 to 100.
Age 2 to 100. Okay, I'm going to make a note of that.
No, we do feel like the pediatricians probably will help with the infant care and some of the special needs pediatrics, because we do focus more on adult medicine, but we do offer services for the whole family, so we hope to have families in groups or individuals, and we want to be available for the needs of the entire population.
So you are truly a family practice.
That is correct. I trained in family medicine in Athens, Ohio, where trained at Oblenis Hospital, part of the Ohio University program, and the emphasis was on the entire family there, and diabetes prevention, and you know, working with a difficult population there with obesity and tobacco use. You know, I feel like I was well trained up until this point for the needs of North Carolina.
You mentioned diabetes, and we know there's a huge diabetic population here. Do you have a special interest or a special area of focus that you like to
Yes, working with the Native Americans, it became a very prominent focus of my practice, was managing diabetes care, and I really have a passion for it, you know, managing people's lives, helping them lose weight, helping them learn the processes that are causing and leading to the disease, and to help them use the medications that are available to properly manage their disease. It gives me great pride when I can get somebody under control and explain to them how this is going to make them live longer.
Yeah, I'm sure it does give you great satisfaction to do that. Now, I believe you said you are taking new patients.
That is correct. We are a brand new practice, so we have an open schedule, and we're very excited to be here, and we have available slots for all family members.
Yeah, let's talk about your hours of operation and what have you. Are you there 5 days a week?
We are. We're there Monday through Friday. 8:30 to 4:30 is our operating hours. We do plan on making an extended hour clinic in the future, so it will be based on when we get another provider, but right now that's our hours of operation.
Well, that's good to know, and sometimes it is difficult for folks to get to the physician's office during work hours because of their work schedule, and so it is nice to have some practices in the area who do have extended hours, so I'm sure that I'm sure that'll happen before too long. Once you the practice grows and you have to get another physician or another provider in there. That
this area is growing so rapidly,
is.
and it was definitely an area that we wanted to be part of because of that potential growth. And we're excited about the opportunity to be on the ground floor of this beautiful hospital, beautiful clinic. I encourage everybody to come see us and check it out.
That'd be great. So I know we've got viewers out there who don't have a primary care physician and are and looking for one. So can you tell our viewers how to reach you?
Yes, our clinic is 584 Hospital Drive, but right next off of Highway 17.
Right.
Our phone number is 910-721-4100.
4100. Well, wonderful, and we'll be glad to give that number out. If folks call, we'll be glad to furnish them with that number. So before we close, is there anything else you'd like to add or share with our viewers?
Well, I'm very excited, like I said, to be here. This is a great opportunity, and I think as a physician, it is my honor to treat the patient. I always go into each encounter with a smile and a handshake, and patients should expect to reach a high standard of care, because that's what I am looking to give. As Novant expects a standard of excellence, and that is why I chose Novant, and I wanted to be part of that. And I treat each patient like they're a family member, and I want them to think of me as their doctor and one that they can go to and trust.
Oh, that's wonderful. You're going to make me cry.
Yeah. It's a long journey here, and like I said, I'm so thankful to be here.
Well, we're so happy that you're here. I think you'll be very, very successful. So thanks for being here today. I look forward to having you back when you tell me about your new provider.
That sounds wonderful.
Okay, great.
Thank you so much, June.
Thank you. Next, we have Christy Williamson with Brunswick Beacon and Victoria Humphrey, the Community Relations Specialist at Novant Health Brunswick Medical Center. Well, welcome to the show today, guys. Christy and Victoria, what a pleasure to have you here today.
Thank you.
Now, let's talk a little bit about you guys first. Victoria, I understand you work at Brunswick Medical Center, and tell me what your role is at the hospital.
I do. I'm the Community Relations Specialist at Novant Health Brunswick Medical Center. I support the Marketing and Public Relations Department and also the Human Resources Department. I help coordinate community relations programs for the hospital, and I also keep track of the community benefit reporting.
And how about you, Christy? I know you work at Brunswick Beacon, and I think you've been there for quite a while. What is your role at Brunswick Beacon?
Well, I have been at the Brunswick Beacon for quite a while, almost 14 years. I am advertising sales executive, and I'm also our special events coordinator. So all the shows that we do throughout the year, I'm your go-to person.
That's wonderful. It's so nice to have you guys here. And specifically, we wanted to talk about the Brunswick Beacon Health Expo that's coming up on February 22nd, I believe. And I think we have a new venue this year. It's at the Shalote Middle School. That's not typically where we hold that. So, Christy, tell me more about what's going to be offered at that event.
I will, and you are correct. We have moved it this year. It's going to be at Shalote Middle. It is a great facility, so we don't have to walk down the long hallway. So that is going to be great. But we offer all types of screenings. There is lots of information available from lots of different vendors. We do car seat safety checks. We have lots to offer for every demographic. So there's something from babies to the elderly.
Now, is there a cost?
There is not. It's free to the public. So we do want to encourage everyone to come out. It's a good opportunity to get to know the medical professionals in the area, as well as find out with the screenings if you need to get some more.
If you need to see another provider. Well, that's wonderful. And what are the times for this event?
It begins at 9 a.m. and it will run until 2 p.m.
And now, what day is that on February 22nd? Is that
It's on a Saturday. It's on a Saturday, so hopefully most people will be off work and be able to attend.
Now, I understand that Novant Health is the major sponsor for this event. So, Victoria, can you tell me a little bit more about that?
Sure. Novant Health will be the major sponsor for the Brunswick Beacon Health Expo. We're going to definitely bring a lot of information about the services that are offered at the hospital, as well as the physician practices. We will also be offering several of the health screenings. We'll be giving out information on the health insurance marketplace, and we'll also have a safe medication disposal at the event.
And I think that's something we do every year, the medication disposal event, and that's pretty popular event.
Yes.
And I think that does the sheriff department help with that, with the medication disposal piece of it?
They do.
Yeah. Well, now you mentioned the insurance marketplace, and of course that's a topic on everybody's list right now. So, how does that work? How will that work at the event?
Well, that's a good question. We actually we will have experts there from Novant Health that will provide information to the participants on how to enroll on the website and who qualifies and things like that. And it's a perfect time because the deadline is March 31st, as we all know. So this will be right before that deadline.
Well, I think that is will be very helpful to our viewers with the marketplace that being coming up very soon. So let's talk about the screenings. What kind of screenings will be offered at the event?
Sure. Novant Health will provide several different screenings. We will have BMI and body fat screenings, also cholesterol, oxygen saturation, blood pressure checks, and several more. So a lot.
That is a lot. That is a lot. So the participants will walk out with a lot of information about their health situation and know what they need to do next.
Correct.
And we've already talked about the medications. And can you give me an idea of what kind of medications you can bring to the event to dispose of?
Sure. You can bring anything and everything. Anything that's old, that's been in the medicine cabinet for a while. We will take, prescription drugs, controlled substances, liquids, inhalers, just really anything that you can think of, no questions asked.
How about needles?
You can bring needles too. We just recommend that you put it in something safe, such as something with heavy plastic like a milk carton or Tide, one of those jugs, something like that. Great
idea. Well, that's wonderful. I think that this is just a huge bonus for the citizens of Brunswick County. I think that the Beacon certainly does a wonderful job with this, as you do every year. And with Novant Health participating as the major sponsor, I think that's a great partnership. So I'm really looking forward to the Brunswick Beacon Health Expo. I know I'll be there. So Christy, once again, can you give us the dates and times for the expo?
I absolutely can. It is on Saturday, February 22nd from 9 a.m. to 2 p.m. at Charlotte Middle School, and I hope to see everyone there.
Great. Well, thank you guys so much for being here. I've enjoyed having you, and we look forward to seeing you at the event.
Thank you.
You're welcome. Our final guest is Dr. Linda Calhoun with Cape Fear Heart Associates. Well, welcome to our show today, Dr. Calhoun.
Why, thank you for having me, June.
It's a pleasure to have you here. I'm so excited to get started because I really am passionate about this topic. So, first of all, how long have you been in our area?
Well, I've been in Wilmington for about 22 years, but we've been coming down here to the Brunswick area for about 5 years.
Yeah. So you've been in Wilmington for 20 years?
22, yeah.
You don't even look old enough to be there 22 years.
Oh, I feel it.
So what brought you guys to Brunswick County? What brought the practice to Brunswick County?
Patients actually get phobic when they see the bridge and, get really panicky. So I think it was really to service our patients.
Great. Well, that's what we want to hear. I'm sure they appreciate that.
Right.
So tell me a little bit about your education and your background. Where did you go to school?
Well, I'm a Georgetown bred for college and med school, and then I came down to UNC Chapel Hill for my residency in internal medicine, and then I went up to Philadelphia at the University of Pennsylvania for my cardiology fellowship, and then realized that North Carolina is really where I belong.
Well, we're glad you're here for sure. Thanks. So let's talk a little bit about Cape Fear Heart Associates now. I know that's a pretty big group. Tell me about your group and your partners.
Well, currently we are 15 physicians and 8, we call them advanced care providers, nurse practitioners and PAs. And, we try to make sure we can cover all aspects. We have about 4 electrophysiologists, All of us do general cardiology. We have about 5 interventionalists, but we just consider ourselves a very well-rounded group.
Let's talk a little bit about the services that you provide at Cape Fear Heart. Now, I know you said you do interventional as well, so you do heart caths and things like that?
Yeah, actually, as you know, cardiology just covers all realms. It covers arrhythmia issues, it covers blockage issues, heart failure or pump issues. So we actually have lots of different testing, lots of different interventions that we can do for patients that have all types of heart disease.
Okay, well, the reason I've asked you here today is because it's February and it's Heart Health Month. And so we specifically wanted to talk to you about women's heart health. So I guess I start very basic, like what causes cardiovascular disease in women?
Well, I think it's easier for me to kind of focus on coronary artery disease or arteriovascular disease. And we're talking about heart attacks and strokes, basically. But this is a process that is a result of multiple risk factors. People that smoke and have diabetes, hypertension, family history, people that are overweight and don't exercise, people that are all stressed out. These are the types of risk factors that can lead to coronary heart disease.
And whether it be women or men, it can lead to...
I mean, it's interesting, but if you look at, women are so scared of breast cancer and cancers in general, but if you look at coronary artery disease, it may take the lives of half of our women, and it's the number of deaths from cardiovascular disease far outnumbers the number of deaths from cancer and all sorts of cancer.
Well, from a layperson's perspective, what would be the difference between heart disease, heart attack, and heart failure?
Well, it's just that heart disease is just generic. As you know, I was just telling you, you can have heart failure, you can have heart rhythm problems, and then you can have heart attacks and ischemic heart disease. These are the types of things that lead to medications for angina, to stenting for acute heart attacks or for unstable syndromes or for known blockages, as well as for bypass surgery. So basically, heart disease is nonspecific, and coronary heart disease is encompassed in that.
Well, what would be some of the warning signs or symptoms of heart disease?
Well, I think that we all know about the grasping Levine sign, which is chest pain. I think most of us are familiar, but women may actually present more atypically. Women have more diabetes. Women are also very stoic because they've had children. They really know what pain's like.
Know what pain is.
But sometimes women may present with severe indigestion. That's 25% of the cases. Severe shortness of breath, exercise limitation, and fatigue. I actually had one woman that came in. She had just been tired all weekend, and we ended up getting an EKG. We found that she had a heart attack over the weekend.
Wow.
Tooth pain, neck pain, shoulder pain. So there's various types, but I think that if it comes with exertion, wakes you from sleep, is associated with shortness of breath and weakness, you need to be investigated urgently.
Yeah, I think some of those things we would just write off as, being nothing.
And
being
I think what's really concerning to me is that women present hours later than men. And that they're so reluctant to get urgent care. And so if you really think you're having a heart attack, you want to call 911. You don't want to just try to make an appointment or drive yourself to the hospital. You want to be urgently taken care of, because time is muscle if you're having a heart attack.
Can women's heart disease be hereditary?
Well, oftentimes it is, and it's interesting because one of the biggest scores that they use, the Framingham risk factor, actually doesn't take into account family history, but I actually follow families, and it's amazing to me how many children, mother or father, how many people are related to one another, because it's so hereditary. But not everyone has to have a family member that's had. They could be the first in their line.
It has to start somewhere, right?
That's right. And so just because you don't have a family history does not exempt you from having it.
Well, and we talked about the symptoms in women. The symptoms in men, would they be similar, or are
they can be similar. It's just that women may present more atypically. But what is really worrisome to me is that not only do they have more atypical symptoms like shortness of breath and weakness and indigestion, but women oftentimes may present with sudden death as their first presentation.
Wow.
They can actually die in the field before they even get investigated.
That's scary.
That's right. But women and men have similar symptoms, but women have more atypical symptoms.
like that jaw or the
tooth pain. I had a lady that actually she had all these teeth taken out, TMJ surgery, and she got an angioplasty, and it turns out her pain went away. So,
wow. Well, that's really interesting. Talk to me about how estrogen might help us. Do your estrogen levels
actually
protect you?
Natural estrogen levels protect women throughout life unless they start smoking. Then when they have diabetes or smoking, the estrogen levels do not protect them from getting premature or early onset coronary disease. But we think that estrogens may have a protective effect as long as a person doesn't have coronary artery disease. There was actually a nice study, done back in the 1990s, where they actually looked at giving estrogen to women, estrogen and progesterone in women that still had their uterus, and they actually found that it was detrimental in those with coronary heart disease. So we don't actually recommend, we actually stop estrogen replacement therapy initially when patients are diagnosed with coronary artery disease. We have to weigh the risk-benefit ratio of resuming estrogen therapy.
Oh, that was going to be my question. So if it could be of benefit, why don't we just...
But actually it was well studied, and it was initially thought it was beneficial, but when they did the prospective study and actually gave patients estrogen alone may be protective if there's not severe coronary disease. However, just talking to many women that are started on estrogen therapy and getting the right dose, it's so stressful. Actually, some patients actually get unstable with that. But estrogen and progesterone is actually a detrimental situation for patients. It increases the risk for more coronary events if they take estrogen progesterone therapy and if they have coronary disease.
Wow, that's good to know. That's very interesting. Well, let's talk about diet a little bit. I'm sure the diet contributes to heart disease.
Well, we all know that your proximity to a McDonald's, Hardee's, Burger King, those sorts of fast food places, actually there's a greater risk for having coronary heart disease. So minimizing the pork and red meat, and here I'm saying pork in North Carolina, in the diet is really important. Trying to minimize fried food, sweets, which have both sugar, fat, and cholesterol associated with it. Definitely trying to eat less processed food, because we know the amount of salt you take in also can affect your risk of having hypertension.
We're getting close to being out of time, so I want to ask you this. If there was one message that we need to get out there to women about heart disease, what would that message be?
I think it's really important to know that most of the risk factors that lead to coronary heart disease are silent. So it's very important that women are screened for hypertension, high cholesterol, and diabetes, because these are silent risk factors. And that women take care of themselves as well as they do other people. Women are great at being caretakers and not taking care of themselves. So if we could just get women to be more aware that they are at risk, and then to take care of themselves and to address risk factors if they're present.
I think we think of that as a men's disease sometimes, and it doesn't affect us women. And
actually, it's the number one killer of women. Number one killer of women.
And, I bet that a lot of people don't know that. A lot of people don't know that. And so I think it's important that folks get a good primary care physician to be sort of their chairman of their health care. And watch out for all these silent things.
That's right, and actually screening, if appropriate. If you're going to do a 50,000-mile checkup on your car, you might as well do it in your body. And I think stress testing actually can screen for silent disease. Even I know there's a lot of different ways to screen, but definitely women need to be screened.
Screening is most important.
Yes.
Well, thank you so much for being here today. I know that February is a very important month for you and your group, and you're very passionate about women's health. So
only because I'm a woman, so.
And I too. So thank you so much for being here. It was a pleasure.
All right, thank you, June.
You're welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. For more information on Brunswick Medical Center, local doctors, and general health information, please visit novanthealth.org. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.